In this video, you'll learn how to administer first aid to a person who has suffered carbon monoxide poisoning by inhalation. This gas is colourless, odourless, and causes no pain. In most cases, it comes from defective boilers or water heaters. Depending on the conditions of the casualty, two possible scenarios can play out. Scenario 1. The victim is conscious. They do not feel well and complain of having a headache, vertigo, nausea, or vomiting. They feel ill and dizzy and may lose consciousness. In such instances, it is highly possible that they're suffering from carbon monoxide poisoning. Open immediately all doors and windows to not take any risks. If possible, turn off the faulty device suspected of causing the carbon monoxide leak. Evacuate the casualty and, if possible, get them out into open air. Place them in a comfortable position in which they feel most at ease. Call the emergency services. Scenario 2. You discover an unconscious casualty and notice that there is a boiler or water heater present in the room. You can therefore suspect that the casualty has suffered carbon monoxide poisoning by inhalation. Open immediately all doors and windows not to take any chances. If possible, turn off the faulty device suspected of causing the carbon monoxide leak. Perform an emergency evacuation and take the victim out into the open air. Verify their breathing and act according to their condition. Meaning that if they're breathing, place them in the recovery position. Call emergency services and cover and monitor them until their arrival. If they are not breathing, alert the emergency services or ask someone else nearby to do it. Then begin cardiopulmonary resuscitation, alternating 30 chest compressions with 2 rescue breaths. If you do not know how to give mouth to mouth, only perform chest compressions keeping a rhythm of 2 per second.